Here is your instant update on the coronavirus in New York City, March 15th, 2020. There are now 729 confirmed cases of the coronavirus in New York State and 329 in New York City, with 3 deaths. New York currently has the highest number of cases, and there are 3,020 across the entire country. It's important to keep in mind that there is a direct correlation between confirmed cases and testing, so while this is the best data we have, it's likely not entirely accurate. Today, we're going to cover key remarks from Governor Cuomo's press conference this morning, hear some updates from the New York Times, and finally learn a bit about the social impact from Trevor Noah. As always, we will keep your instant update under 7 minutes. Let's listen to some key remarks from Governor Cuomo's press conference earlier today. First, a familiar refrain.
Slow the spread of the virus to a rate that the healthcare system can manage. Slow the spread of the virus to a rate that the healthcare system can manage.
Now let's hear his views on testing and the need for greater support from the federal government.
We need more federal assistance in allowing what's called automated testing, which the FDA still controls. Roche is a company that does automated testing. The president made an announcement with them, but it can't just be a couple of companies for the United States of America doing automated testing. We need more automated testing. What does that mean, automated testing? Manual, you put the test tube in the machine. Automated, everything is robotics. It goes from 30 tests per day to 1,000 tests per day.
He also put out a plea for local businesses to support the need for density control.
Slow the spread by reduced density. I've been talking to private businesses all across the state. I am asking them to aggressively consider work from home strategies. I'm asking them to aggressively consider voluntary closings.
Finally, let's hear his take on the complexity around closing schools.
Close the schools. It's not that easy. It's not that simple. Close the schools. For many families, the school is childcare. If you close the schools and the children are home, a large percentage of the workforce may say, I have to stay home and take care of my children. We can't have nurses staying home because they have to stay home and watch their child. So it sounds simple, it's not simple. You close the school, how do you feed the children? For many children, the breakfast and the lunch are the 2 main meals they get, and they get that at the school. How do you distribute food to all these children who are now not in school? So those are very real concerns.
However, at 5 p.m. this evening, Governor Cuomo announced that New York City schools will close early this week. There is still a lot to be determined, but that's major breaking news. Here are the headlines from the New York Times. 2 state assembly members test positive for the virus: Helene Weinstein and Charles Barron. Mr. Barron, 69, and Ms. Weinstein, 67, have not been in Albany since early March for separate reasons, according to the statement. Medical professionals plan for a surge in coronavirus cases. New York City's hospitals, widely considered among the best in the world, may still be moving too slowly to get ready for a coronavirus outbreak that has already overwhelmed other countries and is now taking root in the New York region, according to many healthcare experts. Officials emphasize that most coronavirus cases do not require hospitalization. Still, around the city and country, hospitals have begun adopting plans for a surge in patients. As promised, let's close on a lighter note from Trevor Noah at The Daily Show.
And now, the latest instruction is for everyone to get some space.
We've come to embrace the term social distancing from the Centers for Disease Control, talking about leaving space in large event areas.
That means avoiding group gatherings, plus crowded subways and buses.
Social distancing in action.
Social distancing.
Social distancing.
Social distancing.
The new coronavirus buzz phrase.
Yes, the buzz phrase of the moment is social distancing, also known as "don't breathe on me, bitch." And everyone, from schools to businesses, festivals, political rallies, everyone is doing their part to keep their social distance. But it turns out, one of the groups who's most at risk just DGAF.
The CDC recommends people over the age of 60 practice social distancing. There are few signs seniors are listening. At this softball game at the Villages outside Orlando, most of the players are in their 60s, 70s, even 80s. The only thing they say they've been told to cut back on is their post-game high fives. 72-year-old Rick Sanford isn't keen on any suggestion he change his lifestyle.
Well, I'll be frank and say I think that's bogus, and I think it's something that each individual has to decide upon their own.
Wait, what? I'm sorry, that's insane. You don't just get to decide what you think about a disease. That's not a thing. No one's in the doctor's office like, Doc, be honest, is it bad? And the doctor's like, yeah, it's up to you. Yeah. It's actually funny how all of us here are working on social distancing to protect old people who are the most at risk. But then old people are just out there living their best life. Yeah. They're just like, good luck distancing yourself from these hips. These hips. These hips.
Thanks for listening, and remember that you can get COVID-19 updates sent to your phone by texting COVID to 692-692. If you or anyone you know believes they may have been exposed to coronavirus, please call the New York State Health Hotline at 1-888-364-3065. As always, we will be back tomorrow with another instant update on the coronavirus in New York City.